Beautiful Sebabatso, welcome in the show. It's so exciting to have you here with me. How are you?
Hi, Dr. Mahid. I'm great, and how are you? Thank you so much for having me.
Yeah, man, I'm also doing very well, and I'm so excited to be talking to you today. It's been a while coming. We've been planning this talk for a while, and I'm just going to make this a bit smaller. I want to see your beautiful face. And yeah, the reason why we started talking about this topic is that some of the ladies have been asking questions about infertility. But infertility is a real big topic, and um, we can really cut it up in different pieces. And I know that you're really passionate about reproductive health. You're doing quite a lot of things for women to empower them about reproductive health issues. And you also have walked a personal journey. And that is the journey of endometriosis, which often is also linked to problems like infertility. So that's why we decided let's talk about endometriosis in this show today. So over to you. What is your story with endometriosis?
Well, Doc, endometriosis is a topic that's very close to my heart. As you said, it's through personal experience. And I think I can literally say that it's responsible for the birth of, Sebabatso, the women's health advocate, because it was through my journey of being diagnosed with endometriosis that I got to really understand the different problems that women live with in terms of their sexual and reproductive health. And then that's when I thought to myself, we really need to be having better conversations. We need to be informed more because, what I always say is it's difficult for you to know that you're having a problem if you don't actually know the norm. So as women, we really need to be empowered to know how our bodies work so that when something goes wrong, that, something is, needs our attention and we need to seek healthcare professionals. So what happened a couple of years back, I think 2014, towards the end, I started experiencing severely painful period pains to a point that, I was struggling to walk. And when I had to pass stools or pass urine, it was really difficult. So the thing at that time is that I was already studying nursing. So I had a bit of an idea, or at least I was able to do a bit of research to actually understand that, I might be having endometriosis. You know what I mean? So, which I think was really a privilege because it's not a lot of women that would look at it that like that. So I thought, okay, I might have endometriosis, and then I had to now go over to speak to a healthcare professional, and then that's when I was referred, and then I was diagnosed with endometriosis.
Thanks for that, Seba. Um, I'm just gonna try to get back in here. There we go. So you said quite a lot of important things. So for you, it was just you started experiencing severe pain, and because you were studying nursing at the time and midwifery, you had knowledge and you linked it that it could be that you have endometriosis, um, and else you think you would not have thought anything of that pain. You would not have linked it, or is that what you tried to say?
No, absolutely, because um, severely painful period. Actually, period pains have been so normalized that even when they're really extreme, we never really think that it's something to look into because
Mm-hmm.
it's more pain has become synonymous with womanhood. It's more like
Yeah,
the more pain you can, especially in terms of period pains, the better you are as a woman or the more womanly you are.
sure.
So and I've actually this with even with the people that I work with because I also work in a gynecology ward. And I've also had a lot of conversation through the work that I do around reproductive health. And there's so many women that only got to realize that they have endometriosis when they were actually trying to fall pregnant. And if you listen to them and you hear a bit of history, you get to realize that they actually did experience this pain, but they didn't think that it was something that needed medical attention.
Okay, sure. So yeah, that's so true that lots of women think of pain as just part of womanhood and just take it and maybe take a pill and swallow it and swallow their pain. And actually, there was something really more serious underlying issues. Sebabatso, not everyone listening might know what endometriosis is. So would you mind just explaining what it is?
Okay. So in normal circumstances, when a woman is ovulating, the ovum or the egg is released from the ovary, right? And as this happens, the uterus becomes thickened in order to support the potential pregnancy that might take place. So if the pregnancy does not take place or if conception does not take place, then this additional lining is shed out of the uterus through the vagina. And that's what we will see as menstruation, right? So in a as endometriosis, what happens is these cells that are mainly found in the uterus are displaced to other parts of the reproductive system. And in some extreme cases, they can actually other systems as well, we found in the lungs or anywhere else in the body. And the reason for this is actually not known to scientists at this stage. So what happens is the same process takes place. A woman will go through ovulation, and then what happens in the uterus will also take place wherever those cells are found. And then in the uterus, I said what would happen is that the blood or that additional lining will be shed out through the vagina. But if it's somewhere else, then it does not have any other place or a passage in which it can come out. And then that's where a woman will then extreme pain that gets worse over time. And then as this keeps happening, then a woman will also start forming adhesions, which then after a long time will also result in infertility, because then that sort of changes the structure or the flow of the reproductive health process or the conception process. So that's basically how endometriosis works.
Yeah, so that's a good explanation. So it's basically the lining of the uterus, those kind of cells, and those cells are sensitive to hormones, right? So whenever you when you are due to menstruate, have your period, if I understand you right, then those cells can be somewhere else in your body, outside of the womb, your uterus, and that is where the pain occurs, right?
Yes, you'll have severe because it's mostly around, like I said, in extreme cases, it can be displaced to other systems as well, like in the lungs, for example, but it's mainly around the reproductive. And that's where you'll get severe pelvic pain, because severe pelvic pain that gets worse over time is one cardinal point of cardinal symptom of endometriosis. The other symptom is also painful sexual intercourse because of the adhesions. And the third one is infertility in the long run. So, which is a problem because a lot of women only get to find out that they have had endometriosis when they're struggling to fall pregnant.
And then if you ask questions down the line, they have had some of those other symptoms as well that I just lived with and took for granted. Yeah.
Absolutely. Yes.
Yeah.
And that's another thing, you know, it's endometriosis is such a poorly understood and poorly managed condition, because even amongst healthcare professionals, when a woman goes and says, okay, I'm consulting because I have painful period, a lot of the times healthcare professionals don't think along the lines of endometriosis, which delays the process of diagnosis. Because then, a woman will come in the first time and then we just give pain medication. Second time, third time, it becomes a norm that we just really just give you pain medication to manage the pain without actually looking at what is actually causing this pain. Because I think even for us, we just think normal. Some women have worse period pains than others. So it's quite tricky, because even if you do empower a woman to say, okay, now you have to understand that at this point you need to seek healthcare professional. If that woman comes across a healthcare professional who does not think along the lines of endometriosis, then it's really pointless.
Okay, so now that it's known that you need to be aware of pain and symptoms, why is it important to go seek out healthcare professionals? What can they do for you? And does it make a difference if it gets earlier diagnosed? Can this condition go worse as you let it wait?
Yes, absolutely. Because remember, I mentioned something about adhesions. So the more this process keeps taking place, the more adhesions you'll have, and then the more your chance of falling pregnant or of conception now will decrease. So if if this condition is discovered and managed better at an early stage, then we can really decrease the chances of you becoming infertile, and the quality of life of a woman as well. If you have a management of the condition, because I mean, you can just imagine if you're working and every single month when you're having your period, then you have to be booked off sick, then it really has a very negative impact on your quality of life. So the earlier the management, the more better the condition can be treated and complications can be prevented.
Yeah, so important. So I hope that everyone listening is taking really note. Um, the idea that you have to have pain when you have period pain, so that it's quite normal, that is something that we want to bring across, that is not, doesn't have to be your norm. So don't just take those pain pills, rather go find out what is going on there, and the earlier the better. So that is really the message that we want to bring across today, I think. And then Sebabatso, how did it look? What kind of treatment options are there out there? What would you suggest? What have you learned and experienced?
Okay, so in as much as we know the actual symptoms of endometriosis, the tricky part is that they also overlap with other conditions as well, other gastrointestinal um, conditions, so which also makes it a bit difficult to diagnose. So the gold standard of diagnosis for endometriosis is laparoscopy. That's where you'll have a surgical procedure where they actually go in and remove the cells and take them for histology and find and to see that, okay, this is actually endometriosis. But because surgery is not always ideal, not always accessible to all women, there's been guidelines that have been released to say that endometriosis can actually be treated even before going for surgery. So it can be treated based on your clinical symptoms. Like if you have those symptoms that are getting worse over time, then your healthcare professional can actually say, okay, we're going to start treating endometriosis. So my journey was, after now being able to be referred to a tertiary hospital, I actually went for the laparoscopy. But after that, because it was really bad, I was experiencing terrible pain at that time, and then they immediately said, okay, now we're going to take you for a laparoscopy. And then after that, they put me on contraceptives and pain medication as well. So what the contraceptives did is that they would stop me, they would give me amenorrhea, meaning that they would stop me from actually having a period. So this basically means you don't have your period, then that whole process is halted. It does not take place. And I also just want to bring something in to say that a lot of the times when women experience these, really terrible period pains, they are told that they will get better after you have fallen pregnant. Okay. And then I went and researched this, and I actually realized that it's because during that time, during that 9-month period, this whole process of that we explained earlier on is actually stopped. A woman does it works more on the hormones, then that thickening of the uterine lining does not take place, which is why then the period pains sort of stop for some time. So they use contraceptives to bring about the process, and that's how they manage it. And then from there, it's just pain medication to manage any kind of pain. But I think it's just better because now you're working with what you know, rather than just taking pain medication and not realizing that complications are still coming for you.
So if I understand you well, contraceptives is one of the treatments before you go into surgery, laparoscopy. Basically just to suppress the lining, the thickening of the lining, what happens with the menstrual period. So basically suppressing your normal periods. But isn't that just, I'm going to be the devil's advocate here, isn't it just like masking the problem again and symptoms and not really dealing with the cause?
Well, with endometriosis, there isn't an actual cure for it, right? So it's just a lot of things that are being put together as a treatment or management plan to ensure that we prevent complications. So the actual treatment would be to remove those cells, right? But they can always come back. If once you have endometriosis, then it's something that you will actually always have for the rest of your life. So like I said, with me, I went for the laparoscopy. The cells were removed, but now I still had to take the contraceptives to ensure that the process does not come back. So it's really our best bet to ensure that we manage or we prevent complications.
So if you would like to fall pregnant, then you're just gonna have to bear with the symptoms again. If you would love to fall pregnant and you want to stop with the contraceptives, then you just got to bear with the symptoms again.
Well, luckily for me, I've had certain periods where I did not take the contraceptives.
Mm-hmm.
So the pain was actually not better than before I went for the laparoscopy. Because it's also another thing to say that you are going to take contraceptives for the rest of your life. Usually,
Mm.
I think, usually a gynecologist will say to you, okay, we're going to put you on this contraceptive for 6 months, 3 months, and so on and
Mm.
so forth. Yes.
Mm. Yeah, so it's an approach, and there's like a management plan when you have endometriosis. That and it could be per individual a different plan. I can imagine that. So you got to just find your way through it. So I know that lots of our female issues, period pains, but also just how we feel, PMS, and so forth, is really related to our endocrine system. And our modern days, the more we are stressed, the more also our lifestyles, our food consumption, all those things can be hormonal disruptive. Have you found a link with that, with your lifestyle, with stress, with what you eat, behavioral things, and the relation to the severity of endometriosis?
To be quite honest, well, I don't think I've been observant enough um, to say if my symptoms get worse when but I can imagine that it is a possibility. But I must say I haven't been observant enough to really see that at certain times when I'm stressed or when I'm eating certain kind of foods, that it becomes worse or better. I've honestly not been that observant. Maybe it's something to look into.
I think so because definitely when you get older, it's sort of like your body's less forgiving, and I do think a lot of women's health issues are related to imbalanced hormones. We know that estrogen dominancy is a big threat to us, and yeah, it would be just interesting. I wonder if you've come across in your research if there was any links with that, with estrogen dominance and so forth, and lifestyle, and the occurrence of endometriosis, and if it is a condition that is actually increasing amongst women, that it's, if there's any links to modern lifestyle and so forth. I was just wondering if you've come across some of those links with, because I know you're also doing research on this topic because you're so passionate about it. Yeah, so I'm just curious.
No, not at this stage. I haven't really found anything to do with
Mm.
lifestyles. Say that women living a certain type of lifestyle are more predisposed to
Mm-hmm.
endometriosis. It hasn't really even, like I said, the exact cause for endometriosis is not known, but it's been linked
Mm.
to other factors such as menstruation without an actual cause. And the other thing is, genetically speaking, if let's say somebody in your family has it, then
Mm.
you are also more risk to have it. But lifestyle wise, in my research, I haven't really found something, or perhaps maybe I was not specifically looking for it, but I think it's something worth looking into.
Yeah, I would encourage you. I mean, with us at Sensitive Midwifery, we always try to first find a preventative strategy and a natural approach before you go into having to take medicine and having to go for operation. So that will be, the first choice is try to see like, hey, what else is there that it's a more kinder way of healing your body. So yeah, I would encourage you to go search that angle as well. But I know, I mean, I've just been playing the devil's advocate here a little bit. I know that endometriosis is very much still, there's so many questions on where it starts and how it starts, and it's definitely also linked with your genetics and so forth. But yeah, I do really not just want to accept everything, and we're all for optimal health, health and well-being and wellness. So yeah, if you have got some insights there, but yeah, as you said, you haven't got any specifics on that one. So lastly, when we tackle infertility and link it to infertility, you've touched a little bit on that, but is there anything that you would love to tell to women that are battling with infertility on, what would be the steps that you would like them to take?
Well, I think the biggest thing is to really walk the journey with a healthcare professional. And the most important thing, which a lot of the times women miss, is to actually make your partner also part of the journey. Because, especially in the African context, a lot of the times when a couple is struggling to fall pregnant, it's always the woman's fault, which, is really not true, because men themselves also do issues with sperm count and a whole lot of other things. So it's really important to walk that journey as a couple, and to really find a suitable healthcare professional that will work it with you.
Yeah.
So
So go seek out help, basically. Hey. Yeah.
Yes.
Yeah, and definitely it's a two-way thing. So it could also be linked to the male part. Absolutely.
Yeah.
Yes. Yeah. Big time. Yeah. So thank you so much. I think it was very, very insightful. I've definitely learned from the conversation, and I'm sure lots of women have learned. If there are any questions, we will refer back to them, or maybe we can hop on another call to dive into a bit more deeper issues if there are more questions coming your way. But I really want to thank you for your time, and I wish you all the best with your research. Keep us posted on how that is going. I know it's not easy to do research, being a researcher myself, sometimes just perseverance. I'm sure you can witness of that. Yeah. Yeah, but I'm excited for that study and your findings, so stay at it. Yeah.
Yeah.
Thank you.
Thank you so much for having me. Yeah, it's always a pleasure having a chat with you.
Yeah, it's lovely. Thank you so much, Seba. We appreciate you, and we'll chat to you next time. Cheers.
Thank you so much. Bye.
Bye. So that was Sebabatso. I hope you enjoyed this time together, and definitely if you have more questions that you would like us to dive in deeper, please reach out to us, let us know. This was us for today's Facebook's live show. I don't know what the light has been doing in the meantime, but yeah, have a wonderful rest of your day, and we see you next time. Lots of love.